So then I will switch to English again, and it's my pleasure to introduce the next speaker, Dr. Zaher Nahle. Zaher is a friend of mine since at least a couple of years now. I think we met for the first time in California at a more or less informal ME meeting. Very nice. And then you were very kind to invite me to take part of the magnificent work of the Solve ME CFS organization in the United States. And you've been vice president for some time, I think, in this organization. Vice president for research and chief scientific officer at the Solve ME CFS initiative, which is an organization for supporting ME CFS patients and ME CFS research in the United States, and I would say also internationally, with some kind of international support. So please, Zaher, the floor is yours.
Thank you so much, Michele. I don't speak Norwegian or Swedish, so we are going to settle with the next best thing, which is English. First, thank you so much for the incredible work of RME, the indomitable Kirsten, Helen, Henrique, and everybody else, my friend Michele. Thank you so much. I moved on from Solve ME CFS initiative, so I'm not in that capacity. I have the pleasure since March of leading a medical foundation called the Arthritis National Research Foundation based in the Los Angeles area. And this is an organization that has been really established for a long time. It focuses on arthritis in all its forms, as well as autoimmunity diseases and rheumatic associated illnesses. And under our portfolio, we have osteoarthritis, rheumatoid arthritis, juvenile psoriatic arthritis, lupus, women's health issues, ankylosing spondylitis, fibromyalgia, and other autoimmune diseases. Really, so far this year, we fund investigators at the formative stages of their career. This is the distribution this year of our funded grants. Over the years, we have funded more than $17 million in research funding. We have over 250 scientists funded and more than 75 partner organizations. This is all what I'm going to say about this so far, and this is the lineup of our new scientists. As you can see, they come in all talented shapes and sizes and ethnicities and races, and they are studying a variety of topics from autoimmunity to stem cell biology to arthritis research to women's health issues. No matter what kind of disease you are studying, ME/CFS really ranks on top of all diseases in terms of the poor quality of life. This is actually published studies, and as you can see, the higher you go up here, the lower the quality of life of the patient. ME/CFS ranks consistently amongst the worst diseases when it comes to the quality of life, even more than rheumatoid arthritis and as well as many other types of cancer. So that's why we are here really today, is to cross-pollinate, is to learn from each other, and is to understand more about how we can collaborate in this area of ME/CFS. This is a disease where everything that went wrong did go wrong. There are so many challenges in the disease area. As you can see, there are misinformation and antagonism in our field. There are lack of critical mass of researchers, insignificant funding that typically drives the scientific discovery. We have elusive etiology to date, and we heard a lot of great work this morning, but we still do not understand the fundamental mechanism about this disease. We have lack of FDA-approved drugs, at least that is relevant in the United States. Absent pharma investment. We have insurance and ICD coding debacles. These are important for the access of patients, ME/CFS patients, for medical care. We also have hard career path for researchers, as well as no feasible biomarkers no diagnostic criteria really so far that are definitive, as well as poor grasp of natural history of the disease. What we mean by that is a poor understanding of the onset, durations, gender, genetic predisposition, on all of these important first line of knowledge that we have to know about any disease. ME/CFS still lacks that kind of base level of understanding, and that is truly a tragedy. And we have minimal support of patients. And here again, I salute the work of RME for putting together these kind of forums so that patients can have access to the most innovative information out there about the disease. But to me, really the cardinal problem that signifies incarnate our problem really in the field is the lack of knowledge gap, the absence of critical mass and amount of information, medical information that can educate us about the disease. And here I took the liberty of plotting the publications as a function of time. This is the publication number and a function of time of 4 different terrible diseases. ME/CFS is one of them. And as you can see, in all the other diseases, we can define this shape and size of the curve. In ME/CFS, it's still a flat line. And it's that gap what this defines our knowledge, gap knowledge in the field. And it's no surprise that this absence of knowledge here corresponds with lack of investment and spending by the government, at least in the United States. These usually goes hand in hand. As you can see, ME/CFS ranks on the bottom of the funding by the federal government. However, the message today is a positive message because things have changed quite dramatically in the last year or two in the United States. And that's the result of better commitment from government agencies, as well as an increased scientific and advocacy effort in the United States. And that's now I'm going to try to unpack for you the major changes at the macro level that happened in the US, and I think it influenced what happens here and vice versa. This is a summary of really the policy changes that led to this improved status quo in the field of ME/CFS in the United States. And perhaps that started really with the Institute of Medicine report that came way back in February 2015. That is a report that was commissioned by several federal agencies, including the National Institutes of Health, the CDC, Center for Disease Control and Prevention, ARC, Agency for Health Research and Quality, Social Security Administration, the FDA. These are major agencies in the United States. They commissioned an independent report. And the result of this 300-page report essentially came out and said, shame on us for not investing enough in this disease. And that triggered in the United States a series of steps, some large, some small, that are chronicled here. The first one is a commitment from the National Institutes of Health. And when we say National Institutes of Health, this is the biggest funding agency in the United States, and really most of the science that is done in the United States is done with support from the National Institute of Health. That is different than pharma investment, but that is an essential driver of innovation and discovery in the United States. So the head of the NIH came out and said that of the many mysterious illnesses that science has yet to unravel, ME/CFS has proven to be one of the most challenging. That's a big statement. At the time, that was followed by some action, including what we call an intramural study on the NIH ground, that I will circle back and talk about in a second, as well as supplemental awards to investigators who are wishing to study ME/CFS in the United States, as well as what we call a Common Data Element Project now, which is a major system-wide effort to normalize language. Right now, we are comparing apples and oranges when we compare studies. And what the Common Data Element Project aims to do is to create common languages for ME/CFS so that studies can be compared with some level of fidelity, and eventually leading to a big step, which is the announcement of the presence of money dedicated specifically for centers for MECFS in the United States, as well as many other steps. And this would not have happened really without determined patient stakeholders, as well as organization and serious interest from academic centers and major universities. To cut a long story short, we have now numerous centers in the United States funded by the NIH dedicated to ME-CFS, and these are what are referred to in here. And again, we are going to circle back a little bit and give you a little bit of overview of what is the status of these centers right now and what are they doing. But I do not want to also ignore the fact that a lot of this effort is the result of formidable advocacy work in the United States by so many groups. Amongst them is AME Action, which is a terrific organization. And I always ask the question, how did we go from really obscurity in the field of MECFS to being shortlisted on an Oscar nomination for the documentary category by this movie that was made by Jen Brea, Unrest. And that truly brought a lot of attention to the plight of MECFS in the United States and was a great influencer in defining the path for the future at the scientific level. And these are recent development. Now, these are shows that are very familiar in the United States. This is what's known as the Dr. Oz show. This one is Megyn Kelly on Fox, which is, again, a popular TV show. And this is last week on CNN. It is produced by Ryan Pryor and Sanjay Gupta on Sanjay Gupta, MD, again showing you that there is now becoming more and more acceptance to talking about MECFS in the mainstream media in the United States. And in the United States, do not underestimate how powerful that visibility is. So now let's circle back on the science and the centers for MECFS that has developed in the United States. These are 5 new centers funded by the NIH. And when we talk centers, this means tens of scientists and technicians and healthcare professionals working together in a really massive, complicated efforts. We have 4, one at the Jackson Laboratory, headed by Derya Umtaz, and again, I'll describe a little bit that in more details. We have one center now at Cornell University, headed by Maureen Hansen, one at Columbia University by Ian Lipkin, and another one that is supposed to be coordinating all these efforts. It's called the Data Management and Coordinating Center that collaborate and coordinate all the results and all the activities between all these centers. But that is only one component of the landscape of scientific production and activities in the United States. And if we want to simplify it and chronicle it, we will do it in this fashion. These centers are a portion of an already ongoing effort in the United States done by other organizations, not only by NIH funded money. Chief amongst them truly is the Open Medicine Foundation that is not funded by the NIH. However, through private funding, they were able to establish truly formidable type of work at 2 places, Stanford University, as well as a new center at Harvard University. This is an organization headed by Linda Tannenbaum and Ron Davis. They are familiar names and faces, in fact, heroes in the field of MECFS. There's other good quality work that is done by other organizations, the Cimarron Foundation and Dr. Dan Peterson. In fact, he's the one who was the first physician to identify and diagnose the outbreaks in the United States in the early 80s. Dr. Dan Peterson and the Cimarron Foundation. as well as work by other organizations, including the organization that I was at until recently, as Michele mentioned, where we used to give grants to scientists, including some Swedish scientists here. I'm very partial to the Swedish scientists and their great work through what we call the Ramsey Award that I set up at the time. That is a program from Sweden to Israel to Germany to the UK to the United States that has been producing some result. There is another organization called the Bateman Horn Center, which is essentially the clinical arm of the Jackson Laboratory Project, the center, which is doing also fantastic work. Again, what I'm trying to do is to give you a bird's eye view here. We're not going to delve deeper into the activity of each group, but really there's a lot of effort and a lot of work that is going on in the United States, as well as work at NOVA by Nancy Klimas and her group. Truly a formidable effort as well. These are the people who first identify the cytotoxicity deregulation in ME/CFS going back to the 1998, as well as work at the CDC and the NIH. Now, at the CDC, there's this multi-clinical site effort that is taking place in 6 clinics across the United States. And the idea here is to understand more about the etiology of the disease. And there's work on that, as well as a paper recently published on the outcome, as well as this intramural study on the NIH ground, which is really a clinical trial that is comprehensive. Again, for the first time in the history of the disease, we are seeing these kind of widespread, system-wide activities that are consolidated and tractable. The point I'm trying to make here today is that we could not have printed that last year or even the year before. This is an extraordinary work that is happening all over the United States, and many of these groups truly are cross-pollinating with each other. There is a lot of intermarriages between these groups, and that's something that we like to see. A little bit deeper into the centers. The Cornell Center really is headed, as I mentioned, by Maureen Hansen. It's a collaboration between the 2 sites of Cornell, one in upstate New York, Ithaca, and the other one is Weill Cornell Medical Center in Manhattan. And it is a program that is using a lot of sophisticated technologies and focusing on understanding post-exertional malaise in general. It has several projects, 3 projects, one on extracellular vesicles, which is an important aspect of ME/CFS right now. It's very promising. Exercise physiology type work, cardiopulmonary exercise testing, and trying to understand the biology of post-exertional malaise, really using exercise physiology type assays, as well as high throughput screening and sophisticated analysis. The work at Columbia is truly exciting and formidable because it also incorporates members of the NIH and the CDC into the program itself. It is a program that is analyzing, again, using the most advanced technologies, the virology type work, but also bacteria and fungi and all kind of pathogenic deregulation in ME/CFS. It is also focusing on the lipid aspect. We heard about this in the morning, lipid component of ME/CFS, as well as a project that is aiming at improving the diagnostics in ME/CFS and using technologies like wearables and such to track the disease and the etiology of the disease. And this is another center that I will focus on in the next 2 minutes or so. And again, that I think it's doing extraordinary type work through 3 projects. One on immune profiling, the other one is metabolomics, meaning trying to understand the abnormalities and alteration in our metabolic patterns as a simultaneous readout in patients with ME/CFS. And it is also studying the microbiome in a very comprehensive manner, nutrient-gene interaction at the level of the microbiome. And you hear a lot of the microbiome and its influence in ME/CF biology, but also in all type of really diseases these days. And that is a center that's also using machine learning and artificial intelligence to create these kind of sophisticated algorithms that would be predictive in the way we diagnose patients, but also treat them and evaluate them, and mainly evaluate their response to different modalities. So this is headed by Derya Onumtaz. I told him I'm going to come see you, so he sent this picture and he says hi to you. Derya is one of the really truly formidable immunologists in the United States, but also around the world, and he's the one who gave me these slides to share a little bit more on these types of projects. As you can see, the first one will address the microbiome to try to understand really all the aspects of this, gut-brain interaction, we call it, the gut-brain axis, eventually leading to understanding of the molecular mechanism and why are things changing and how. And the more we understand about that, the more we are able to design strategies to target these abnormalities and deregulation. The other one is the immune system, again, using sophisticated methodology. They are trying to understand the profile, creating a fingerprint, really, for the aberrations in immunology that happens in ME/CFS patients and only in ME/CFS patients. This is a little bit about the microbiome sequencing without going into much details. Again, it uses the best technologies out there, and the objective is to identify at least 100 unique signatures in the microbiome that correspond specifically to ME/CFS patients and their subgroups. This is, a fancy representation of the immune profiling, using, again, the highest, most sophisticated sensitivity in that technology and how it developed, mass spectrometry. And this is the artificial intelligence map, so to speak. Again, it's very complicated, but it uses algorithms and computer-assisted technologies to understand more about these subcategories and creating a certain hierarchy about these disease symptoms and symptom areas to be able to predict the subgrouping of patients. And again, we are going to start seeing a lot of results from all these centers very soon. And that is very exciting because now the effort is consolidated through serious people having serious technologies, using the best approaches out there in the world. And also they are collaborating with each other. And that is something that is also very advisable in a field like ME/CFS. This is the last slide about these centers. And as I mentioned, it's coordinated by a data management and coordination center. And this is just to show you the seriousness of this work and the type of rigorous analysis that is performed by this group. Again, these are data management centers that contains an informatics core, meaning computer-assisted cores, and analytics cores, administrations and meeting coordination for logistics, communication and outreach, study design, study management, data architecture, data science, statistical support, qualitative research. My goodness, I mean, there is a lot of work that goes into trying to put these centers together and coordinating their work. And again, we are very encouraged by what is happening around us in the United States on the ME/CFS scientific front. There are other type of work that is happening in the United States as well. For instance, here I mentioned 2 system-wide projects. One of them is an issue that is going to come in Frontier. It's a publication now dedicated to MECFS, an entire issue. It's really done by Ken Friedman. He's the lead on this, and I am helping him editing some of these articles, as well as Dr. Cindy Bateman. The Common Data Element Project is also another system-wide project, and the results of that are going to come very soon. This is, again, like I said before, it is a project that is undertaken by 60, 70 scientists and physicians and stakeholders gathered by the CDC and the NIH to come up with common language that will unify MECFS and the diagnostic criteria of MECFS. This is technical and maybe boring to some of us here, but it's really the foundation of how study design is laid out. And that is fundamental. All types of diseases have this kind of basic scaffolding, if you like, basic structure. And finally, we are going to get that structure in the United States and really in the world. So, in short, really, the message that I'm trying to convey to you today is that there is so much positive development in the field of MECFS that is happening on the scientific front in the United States. There is an improved overall MECFS ecosystem, as I like to call it, and that's an ecosystem that is going to support each other, to support one another, and all the participants in it. And that is also through initiating high-quality research across every phase of the discovery process. So the ball is rolling step by step, as Kirsten liked to say, but it is moving forward, and these steps are forward. And the nature of scientific discovery is difficult. And it's complicated, and sometimes you have to go in a zigzag manner. If it's linear, we won't be here. So it is zigzagging, but it's in a forward direction, step by step. And we are building more ladders. Really, I mean, if I want you to remember one thing from this presentation is that there are now more ladders than chutes in MECFS. Right? We have advanced technologies that are being applied to the field, again, by very serious and experienced people. We have visionary policies that are beginning to change now the way we look at the disease. We have new discoveries and breakthroughs are coming out. The science-based entrepreneurship will be triggered. And we have less of the poor quality. The more you have eyeballs on these centers, and the more you have people collaborating with each other, the less garbage science, the field will produce. And these are all positive developments in MECFS. So with that, I'm not going to bother you with the fat mouse. So we'll stop here. And again, I want to thank the RME for the formidable work that it has been doing throughout the years. I mean, this is the name of the game. It's sustainability. It's waking up day and night, way in, way out, to try to advance the field. And thank you, Kirsten. Thank you, everybody, for the opportunity to give you this general, even superficial overview about what's happening in the United States. And I think we are very energized by all the work that's going on. Thank you.
Thank you, Zaher. We have one short question for Zaher. Yes? Does it work?
Can you hear me? No.
No?
Can you hear me? No. It's not working screen. Thank you. No, just one short question. Is also the interest from big pharma increasing? I.e., are they investing more money? That's my question.
I think big pharma have big appetite, so that will come later. I think there is interest from small pharma. We are seeing that, and that's kind of startups, and these are the first steps. But I think that will come.
Okay, thank you. One more short question. Yes, over there.
Are there any treatment studies going
Well, it's, as you know, it's all experimental right now, so we can't call them treatment, as we define the word. But there are some, pilot studies and trials. But we know from recent history that it's very important to be careful about, over-promising. And of course, there is a long way for these type of treatments and reliefs because they have to go through steps and process. So right now I hesitate to say that we have something really concrete, but what I know is that there are several very promising avenues that are being pursued, and I think the result of that will come in a few years from now at least. So, sorry,
okay.
That's the best I can give you.
Thank you, Zaher. Perhaps I wasn't clear about that, but for the last year and onwards, you're now Executive Director of the Arthritis National Research Foundation. However, I think that I hope that ME/CFS will still be an important task and issue for you in the future as well. So thank you. One warm applause again for Zaher.